A quick note before we start, you can find all links and resources discussed in the video description, and please use them to support us. Please also comment, share your opinions, and ask any questions. Thank you and enjoy.
All right, guys. I'm Abhishek Singla, and I'm the president of SASS, South Asian Student Society. We are organizing this workshop or webinar with Dr. Vikas from Norway, and he'll be guiding you towards the steps to become a doctor in Norway and how and what's the lifestyle of being a doctor himself. And I leave it to him.
Yeah, okay. Hello everyone. I will just present myself before I can just talk about something a bit about Norway. So if someone has like any question, you can just write in the chat also. Abhishek will try to answer if I will see in the chat. I can see actually the chat. Yeah. So basically, I can say about something about Norway. Okay, what Norway is actually. Norway is a country with the tall mountains, like the fjords, cold, and also, of course, it's a cold weather. It is a country of rich Viking heritage. Also has like natural beauty. Also, it's like depend like which part of the country you are living. So it's also depend, but like mostly like it's not like a flat country. So it's like a mountains, like not a very like tall mountains, but like it is very like that, all like sea and mountains. So they have like Norway has like do you see in this picture, this is like taken by me. So this picture is like northern lights, also the Arctic skies in the there was an Arctic circle, we say, like north of the Norway. Also, there's a vibrant urban life in Oslo. Also, like Oslo is the capital city of Norway. Also, there's a few other a few like the big cities in Norway. Also, if you see in this map, like here, it's Trondheim. It's one name. It's like also there's other cities also like Bergen, Stavanger, Tromsø. Yeah, so there's big cities also. Also. The one thing is like one thing is important for as I like when we talk about Norway, like when we think about Norway, so we think about okay, they're one of the richest country in the world, or like how it is possible, you know. So it's because they have the oil funds. What I have wrote in this slide, like they have like approximately $1.4 trillion, and I think it's increasing. I think one of the largest sovereign wealth fund in the world. Like if you will check on this website, so if you are really interested about to know about the how what is this actually. So but they don't use this money actually because they won't think this is for the future, you know. So they just put this money on the like the share market, or like different biggest companies like Facebook, Amazon, like these type of companies. So I think so actually this is what like little bit about Norway. So okay, we go to the next slide. So actually I can introduce myself. My name is Vikas. Also I graduated from Gumedi in 2022. Also my journey began as a doctor, as a kind of GP on the rehab, also like 2-3 types of job, like on the same position I did, like on the 2-3 places, different. And I started working in July 2022, actually. So after 7-8 months, I worked there. I worked as a temporary job on also in neurology department, where I'm currently doing my internship that you call STASS, or you can say in Swedish like OT, or Norwegian LIS, and So that's kind of internship. So I'm doing right now in this hospital that I wrote the name NLSH Bodo. Also, actually, I started learning Swedish at first, but then I switched to Norwegian. I started learning actually in 2021. So also, it was not big. It's also like because of the better job opportunities. Also, the main important thingy was for me is the visa process, because I'm a non-European citizen, so it's not easy to. Sometimes it's taking time to get a visa, like work visa or something, and so that was also one thing I saw when I was choosing between like Sweden or Norway. Like this is also one thing. Also, getting job opportunity, like getting jobs are maybe easier than Sweden. I would say this is my personal experience, but like everyone has their like every country has their pros and cons about like jobs and these things, but it was my personal thing, and I see it like from other friends also they are also working here in Norway now, like 2-3 from Gumed, so I know. Yeah. So actually, in January 2022, I have like a clinical rotation, like almost 1 month in near to the Oslo, and actually I applied for like many places, like maybe I don't know, maybe like same thing as I applied for jobs, like 100, 200, I don't know, like I applied everywhere actually, like a whole country, from north, south, east, west. So it wasn't really matter for me. So yeah. So I got my first job before I graduate from GUMED, actually in the June, like in the last week of the May, also in the June. We will talk about like how I actually got a job, or also like how I started actually. So I have one slide for that also, like from GUMED to Norway. So we will talk about that. Yeah. So this was like a short introduction. Also, yeah. When it's always like everyone think about like, okay, I will choose this country, like, but why? Like, is it worth to go there? So we have like many questions like in our mind, like okay, is it how actually that country is, like when we are sitting in another country, also thinking about another country, and we never been there, so deciding about that, like it's a very like it's like a huge step in your career, like should I go there, should I start learning a language, or should I start preparing for exam or something like what they needed. Yeah. So we can talk about like some advantages and disadvantages, like if we would say that yeah. So Norway has, of course, a high quality of life if we are comparing with other countries in European Union. I'm not comparing Norway with Asia or USA or like African countries. I'm just comparing the Norway with another European Union countries, because you guys everyone is studying in other European countries, in my opinion. Yeah. So actually, they have like a high. They have consistently like ranks high in global quality of life index due to excellent healthcare, education, social welfare system. Also, we have talked about like natural beauty, like the landscapes and like mountains and forest, and and outdoor activities. Yeah. Also like safety and security, and like Norway has like low crime rates, so that you can also read on Google or something. Also, this is my personal experience also, it's a very low crime rate. Also, they have really strong economy, because the salary is like very very high compared to other European Union countries. Also, they have unemployment rate is very low. Also, the Norwegian government is like very like focusing on environmental protection and sustainability and clean air, water, blah blah blah. Yeah. So that's not really, maybe for some people it's very, very important, but for some people it's not really, really important. Like, so I don't know. So yeah, also one thing is very important for people, because everyone like here is like different religion, different like culture, like the food, like languages, so it's like that's very important for everyone, in my opinion. So yeah, also here you can find in Norway, like you can find like immigrants like from everywhere, actually, from Asia, Africa, like USA, like everywhere, actually, like you can find people here also. So that's why it's very easy access to get like the food from the other countries, and like you can, yeah, so it's much easier here to get like things that we can't get in every country. For example, this is my personal also experience, if I would say. Also, you can find like same people like you that speaking the same language and like the same culture or something. Yeah. Also, disadvantages we can talk about, like cost of living. This is the main thing, like everyone, I think I heard like maybe 1,000 times from people like, yeah, but like Norway is very like costly, like it's cost of living is very, very high in Norway. And it's like, yeah, it's true, but like for example, if one room flat like costing $600 to $700 like per month, it can be 500 also. It's depend where you living, with whom you living, how also where some like depend on the city. Like almost all cities, like you can find like 600 to 700. So let's take like 600, 700. Groceries, like this is like we like everyone like has like a student, like the student life, we always think about like, yeah, the groceries are also like, it's a very, very, very important for us. So it's spending like $200 to $300 per month. Like this is, I'm talking about minimum, but like maximum you can go more. Also, like if you think you want to go out or like eat on a restaurant, like going in restaurant or something. So yeah, that's I think it's a bit like higher cost, like compared to other countries. That's I 100% agree. Yeah. So if anyone has question about cost of living, so they can write. You can write in the chat, so I can answer after that. Also, the next thing is weather. That's also as a very like important thing for everyone, like to come to a country where you never have been there. Also, yeah, so weather is like temperature is like usually stay around 0 degrees Celsius, like along the coast. In the winter it can be minus also 5, 6 or something, but like yeah, so it can be like 10 to 20 also. So it's depend like also where you living. I'm living right now, it's a bit north. So yeah, so the temperature is here also like today is like 4 degrees, so it's not that bad. Also there is sun. I will try to show you, but later. Yeah, so summer is like May to August. So yeah, so I think it was quite good summer. Like I've been here like for 2 summers, so I spent 2 summer here. So I wouldn't say that like someone had wrote about Texas. We will talk about Texas, of course, 100%. Yeah, so the summer is like was quite good, because in June to July or like August, like you can find a 24 hours day, especially in the Arctic Circle, where right now I am living in the Arctic Circle, about the Arctic Circle, you can say that. So I have like the 24-hour like midnight sun, so it's like it was really, really a good thing you can enjoy in the summer, like if you go out or something. So Yeah, but like in my opinion, what I have experienced with Norwegian people, like they don't care about winter. Also, they go out in winter. They do many activities like in winter also. So also there is a say in Norway. There is not a bad weather. There is a bad clothes. So it's like. It's depend on your clothes, like how you wear, what type of clothes you wear. So or they go out, like, yeah. That also, like, yeah, culture adjustment, that can be very challenging actually in Norway if you are working with Norwegian people, because in my opinion, Norwegian people in the beginning, they are not like very open, like compared to other countries maybe, or like especially in beginning, like but they can it can be, they are like not like I can't say like people are racist here, like so don't think about racism, like it's their culture, because they are like to be being like in together, because it's not about like one Norwegian person can have like easily socialize with other Norwegian person also. So it's really depend like in what situation we are talking about. Like if someone is working with me, so it can take time to be like to be open, 2 months, 3 months to be like very like good friends. So it can take time. So it's depend like how the situation is, yeah. So it can be challenging, of course, and I think it's everywhere you will go, it can be challenging for everyone. So yeah, also bureaucracy, like I think it's not that bad, like if I will compare to Poland. So in my opinion, it's okay. So the visa process, or like the government, yeah, like it's slow, they take time to do things, but it's not that slow, like you will lose your hopes and you will like, I have to leave this country and this, blah blah blah. So yeah, so that's a quite like a journal summary of like is it worth to live or work in Norway. So I think it is worth to live here. So this is my personal experience. Also, like I talk to many people like here, so who migrated here. So I have a lot of friends. So if I would say, yeah. So the first and the last and like the most important thing, I think everyone think about the language, because this is the most important thing. I mean, like everyone wanted to hear, or also I wanted to talk about that, because without language, like there's no job actually. Like you can't live here without language. So I think this is the most important thing. If we are talking about in this seminar, I think if someone will ask like what is the most important thing, I think this is the most important thing. So everyone here, like as an English speaker, you guys, everyone speaks English. So I think learning language Norwegian can be relatively like manageable compared to learning language from entirely different language families. For example, this is like the German language family. So also words with a similar root with the English, also resources availability, because it's very easy to find resources when you speak English compared to like if you don't speak English. Also I have like experience like people who are migrated to Norway, also they never spoke English, also they started directly learning Norwegian, so it was hard for them, but like people who are spoken like whole their life English and studied in English. So I think it was not that challenging for them. They quite managing like very well. Also, like people like have never spoken English or like any European languages like from earlier, they also quite doing well. Like, so it's depend on person to person, to be honest. But if you really want to work here, you have to learn the language and you have to know the language. This is the first thing you have to do. And if you see this slide, like there is online language courses, like I just like give like the like the schools, like the online school, if we will talking about like Alpha Schoolen .no, it's written Lingu, Linu, Speak Norsk, Note.no, also learn norwegiancommunity.com. So you have like actually like many possibilities, so you can join the course like the like the language, yeah. Also, like I learned like with like I used like many free resources, so I would recommend like who ever wanted to start learning like from today or from tomorrow or like in future, like in near future, so that you can do, like you can try with the free resources. And I would say like it's very very good, like even if you don't have like a school, you don't want to pay, you are a student, you're thinking maybe you will not go to Norway, or I don't know. So I have experience actually the online language course like free with the Alpha Skolen. I have joined the Lingu has like their own program with the free for the healthcare people, like the nurses and the doctors and the pharmacists, like the who will want you to work in Norway. So you can actually get a scholarship that you have to find on their website, with the link with the lingu.no. So just remember that. Also, like they have all the time like free language like cafes like on the Facebook, so every language school has their own things. Yeah, so we talk about free resources. So first thing, if you will read that like norske, it's written like the Karense is like this, she's a YouTuber, like very famous YouTuber. She has like 1 million followers, and I think she has like video for everything, like from zero to I mean, like actually you can learn. Some people told me that like they learned like 80% of the language because of her. So just try to check the first link. And then the next is like the podcast. You can hear the podcast. And third is like this is the free website for the learning language, like from there's a university, NTNU, so they have like everything free if you will click on this link. And the next is like Norwegian teacher. She has also good videos. And the second last is grammatik.com. And this is like every like grammar you need. It's a free, so you can. It's really good. I recommend this website also, like to learn the grammar if someone is really really interested in learning grammar. Like also, it's a base also. Also, the next is like the Reddit. That I took this link from the Reddit, so you can read and learn like more things about Norwegian language and Norway on this link. So someone wrote very good. So this is about the language, and I see in the like someone wrote about like is there specific level. I mean, as a EU graduate, like there's no specific level, but I think B2 you have to know B2. Like you can write the language, you can read the language, because you wanna work in like in the healthcare, So language is really really important. Like even if you don't know like what's the dose of the paracetamol, it's okay, but like knowing the language, it's very very important. So remember that. So language is the most. I mean, I would say that than anything else. Okay. Just write on the comment section about language, so we will try to. Yeah. So working as a doctor in Norway. So of course, like they have really modern hospital infrastructure. Like even they have like some old hospital they are converting, like, or they are building the new ones. Of course, and they have actually. I have been like 4 to 5 hospitals in Norway, and I think it is really good infrastructure. Like if you will talk, if someone is really, it's if it's really important for someone to have a good infrastructure to work as a doctor, but they have really, and like well equipment, or like they have like good. I think it's a really good. also like they are flat like hierarchy in hospitals. So for example, I'm working as a junior doctor, so there's nothing like I don't have to be say to doctor to the my senior doctor. I would say just name, like, hi Martin, like, can you help me this thing? So there's no hierarchy here, like you are scared and there's a surgeon, like you have to be really like to ask them, like request them or something. So there is nothing exist here at all. And if you will start saying doctor to someone, so they will ask like why you are saying. Actually, it's happened with someone also recently. So working hours, everyone is like thinking about like before they start working like one healthcare system. So working hours is like 37.5 or like 40 hours, if you will say, like in a 1 week, so Monday to Friday. But if you have job on Saturday and Sunday, so then it's just 40 hours. But if you have like overtime, so you will get paid for everything. So there's nothing like you just burning yourself or something. Yeah, but like of course working as a doctor is not easy. It doesn't matter where are you and what you're working for, but like, yeah, of course it's quite manageable in my opinion. Also like the duties and the team spirit it's very, very organized here. Like it's not like they don't know who is working after 5 days, who is working after 20 days. So everything is very very organized by the I mean the department leader. Or you have also one person who as a junior doctor, so that person has like she or he will help you about like things about like if you want to have like holidays, or like if something happen, or like different kind of things. So you don't need to be talked to a doctor or like the boss of the ward where you're working, for example internal medicine or surgery or something. So they have their own people, some who fix these things about organize the duties. Yeah. When we talk about the salaries, like I just wrote the normal one where like everyone start that like maybe approx $60,000 per year. If we will talk about like the normal salary, like the basic one that almost every doctor is getting that man. But like about this, like it's depend on your, of course, your qualification, how much you what kind of patients you're seeing, which ward you're working. But this is like, let's say it's a basic salary, $60,000 per year. Also taxes little depend, like if you are a student, you have a loan. If you have like bought a house, like if you bought a car, you have loan for car, house. So then it will be like less, you have to pay less tax, of course. But like let's take it's like between 25 to 35. This is like if you have $60,000 per year, then you have to pay this tax but you can actually decide by yourself how much you want to pay actually. So you can adjust by yourself online actually. Like for example, if you don't want to pay so much tax in this first 4 or 5 months because you want to save something, you want to buy something. So also this $60,000 is someone asked like with tax or without tax. No, this is with tax. You have to pay tax after that. So $60,000. So let's take like 20-30% you're paying with the $60,000. But this is just basic salary I'm talking about. Like people are earning more than that, like, of course, in my opinion. Also when we talk about the salaries, like, so this is a junior doctor, of course. Yeah, this is a junior doctor salary. This is we are not talking about I mean the specialist doctor who is working in specialization. I'm just talking this salary this is for the list one, like stash people, or maybe before stash even. Also, this salary is only for hospitals. But if you will not work in the hospital, if you work on the districts, so this is the salaries depend district to district where you work. So it can be 1 million also, like I mean the Norwegian crown. So it's depend like where you're working actually. So this is for hospital I'm talking about. Like, yeah. Also there's a one benefits what I would say like to working here is like the national resources and guidelines, and this makes you as working as a doctor much easier than if you will compare with other countries. If I would compare to Poland, for example, or maybe other countries in the European Union, so they have like their handbooks, and they are really updating those resources time to time if you will go there. And in hospital you get like free access for everything, so almost like everything that I wrote here, it's a free access for that. Or the second one is like for the drugs, because we as a junior doctor, we come to a country where we don't know how much paracetamol we have to give. So you just open this website, it's called Feles Catalog, just write the paracetamol, and then you will get to know everything. So if someone can just write now and check that out after that their seminar. And the third thing is like the health director. This is their website about also guidelines and like how to and like every kind of information also you get, like there's a proper guidelines they have, so you can actually follow those guidelines, and we follow the guidelines actually. The fourth thing, it's called DIPS. DIPS is like it is like the hospital journal system where we write about patients, so you can actually check on the DIPS like what happened 15 years ago with this patient. Like it's everything there. Like you just write there the number, the national number, like the 11-digit number, and then you just search the patient, like where you're working. For example, I am getting a patient from I don't know where, and I have to prepare for this patient, like why she was coming, and I have to check. So you just write on this platform, and you be using, I think every hospital in Norway they work using this, and also in districts they have their own system, but it's connected with this. So it's very, very like proper, like organized with this system, and they are doing with the AI also now with this system. I heard or like I read it about this, they're connecting this system with the AI. Also, the last one is like, it's called in Norway Kjerne Journal. Kjerne Journal is like this journal is like everyone can access, every doctor can access for any patient in this country. For example, if I am treating a patient from Oslo and he came to here to the north, and I don't know anything about him, I don't have any journal, like the first thing I can just open his this journal, and this journal can give you like what type of procedure he has like earlier, what type of disease he had, like, and what type of medication he had, like last time what he bought actually from the apothec, like to the pharma shops, like pharmacy. Yeah. So this journal is like and they are like updating this journal, keep updating. So I think it's very, very good in my opinion too. And every doctor has access for this journal, like for every patient, like they can check who is coming to them, for example. Yeah. So when it's we talked about the modern hospital infrastructure, so this is the hospitals like in 2024 ranking, like they have like list of hospitals, like it's 6 of them have 250 best hospital in the world. So 6 hospital has like included in the list, so you can read it after that who is interested in these things, whoever. Yeah. Let's talk about like after GUMED, like this is the first picture on the top. It's the everyone knows who is studying in the GUMED. So this is the university hospital, and the picture that below this is where I am working right now. So okay, meanwhile I have been other places also, but like let's just talk about like now. So the first thing as a doctor or as a nurse or as a pharmaceutical or dentist, like you have to obtain the Norwegian license, or it's called authorization also. On that you will apply, like I will share the links like how to apply with that. and what document you need. Actually, you don't need so much documentation if you are as a EU graduate. Like, you just need a diploma, your diploma that you get from the university. You get the transcript also from university, and you just upload your passport and the application form, and that's it. And it's just like 3-4 documents, and you will get your license maybe in 1 month or 2 months, maximum 3 months. But let's take 2-3 months, just we say, for the maximum time. And also, before you getting the Norwegian license, of course, if you have opportunity to get the clinical rotation, do that. Anything, any type. Don't think about you will get a job there, or you can earn money as a non-European. But as a European citizen, if you have a European Union passport, so it's very easier to get job before you getting the license, because then you don't need so many things. Actually, you just need a visa and passport. So third thing is apply for jobs. You have, after you get your Norwegian license, you have to apply the jobs. You can actually apply for jobs before you get the Norwegian license. What I did it, that's also possible. But you have to apply, and you can't just think about okay, you just apply for jobs and you didn't hear anything from them. Sometimes people send you a mail back, if they want you or not, or if they are interested in you and they want to take as an interview with you. So this is the most important. I will share the link because people think about how to apply jobs also. And after getting the job, then we have to apply for the visa. This is for people who are not have European Union passport. So the fourth point, and this is online, you can apply also visa. So you just need to come to Norway, you just need a visa, like the police temporary residence card, or any temporary residence card for many other European Union country. So you can enter to Norway, you can submit your all documents to the police station, near police station that you will find on the website, when you are applying. So everything is organized, and you just submit your papers. And most probably there is also one thing, you can actually start the work in the same week, because they can allow you to start work in the same week. So it's also possible. But if someone have no Polish temporary residence card and you graduated already, you couldn't have you don't have the job, you didn't get the job, you went to your home country, or a country where you need a visa to come to Norway, that's also possible. I know some of my friends, 2 friends recently came to Norway, and they get the visa in 1 month, or maybe 1.5. So it's very possible. And then they just came to the Norway, and then go to the police station and just show their passport and get the residence card. So that's also not so hard to get it. And the sixth point, someone asked also about the internship, SASS, or any other country. Norway doesn't accept any internship from any other EU countries, also non-EU countries. So if you are a specialist in other EU country, then it's accepted. If you are a cardiologist in Poland, you will accept it as a cardiologist in Norway. That's fine, or Sweden, or Denmark, or any other countries, European Union. So if you are doing SASS in Poland, they don't care about that. You will not consider as you have done your internship. This is so far this is the rule, but we don't know about the future. It can change also, because they have talked about so much about these things. So let's say okay. Also about the specialization, everyone here think about the specialization, okay, how it will be for me as a working as a specialist in future, So here in this slide you can see the temporary positions are available for anyone while waiting for you an official internship. For example, I was waiting for my official internship, and I actually was working as a specialist. So they don't care about it's just up to you. If you can manage that job, you are free to go. you work as whatever you want. Like I work as a neurologist actually, like 7-8 months. So it was up to me. I can handle it or not, and they helping me. That's how the environment is here. Like they will help you as much they can. As a training, so you will consider as a like you are not a specialist, so but on the papers you are working as a specialist job, you are working as a specialist, so it's also in one biggest one benefit you you can get it here. So you will not like lose your job, or like you will sit at home if you really don't, if you want, so that's another thing, but you won't lose your job. I have never been lost my job or like sit at home. Yeah. Also, then second thing, everyone think also this is an important question, like you have to apply online for this official internship, and there's also special one website where you have applied jobs, so it's the same website you apply for that, and the selection criteria is like job experience plus participation in online interviews. So they really care about what you have worked, and your online interview, how did it go for you. Also, people will think like, yeah, I didn't study in Norway, so maybe they will not consider me as a right candidate or like for this position. They don't care about like where you study, because I think 50% Norwegian students are studying also outside. So many, I don't know the number, but like, yeah, they also one thing. Also, like after you completing your internship, you will apply for the your desired specialization. So there is no exam. I think everyone think about like, yeah, I have to give one exam. Yeah, for other countries, I know there is so many things you have to do, but here is like you just apply for the job. Like you are applying for the job. For example, if I want to become a specialist in internal medicine, I just apply for the internal medicine post. And the one good thing, or the best thing I would say, here you can do whatever specialization you want to do, because they have so many the positions are like empty because they don't have the specialist in this country. That's why many Danish doctors and Swedish doctors comes here in like 2-3 months they're working as a specialist position. So this is also a good thing here, you can do it. So I never heard like, oh, I wanted to do this specialization but I didn't get it. Also, you can switch your specialization. That's also a possibility here. If you started working in surgery and you didn't like it, so you can switch your specialization after 1 year. Some people did it. I know it. Yeah. Also, internship is like 1 year plus 6 months in district. 1 year is 6 months in internal medicine, 6 months in surgery, and 6 months in district. But like it can be also 4 months, like 4 months in psychiatry, 4 months in internal medicine, 4 months in surgery, and then 6 months in the district. And then after that, you're free to go. You can work wherever you want, wherever you have that job or you want to. Like the specialization, whatever you like. Also, some of them have asked me like what I can do outside hospital, or what I am doing, or what you guys can do. So these are the things like I did past like in 2 years, like you going out. You have like mountains, like you can just trekking, you can cycling, you can have like the saunas are very good here, like that you can have bath. There's a very like it's a culture also, like you ice bathing also, like something. So you can do. Also, there's one picture with the plane, so you can just go other European Union countries or to your home countries whenever you have holidays. So it's depend on you what you would like to do. But it's a very, very like it's many things to do here. So it's just not like it's just long winter, or you have nothing to do. You just sit in the hospital or like wherever you're working. So I think it's many things to do here if you want. Yeah. Also here is like important websites. Like first is like Work in Norway. Here you will get like everything very clear cut. Like if you are outside EU, if you are inside EU, like how to apply for residence permit, how to apply for jobs and everything. Second website is like how to apply for authorization and license. Someone ask that thing also about like how to apply, but I think we need a more time to discuss maybe in the future, like about these things more detailed, like how to apply in these things. So, but this is the website you can really easily do it. So it's not a very hard. Also, third then website is like it's called Web Recruiter. This is like the website where you apply for jobs, where you apply for like, this is like very like mandatory here in Norway. You have to be put a job on this website. So you can't just be like, I know other countries like it just like in the you have like son of this doctor or this you can get the job. No, it's not like that. You have to be put a job on this job market portal, and then you will apply, and then they're choosing the candidate. So this is like almost 90% jobs you find in this also internship that lists one, you have to be apply for this portal. Also, last one is important for the people who will migrate here. It's called udi.no, and UDI you will find it's called skilled worker, because we as healthcare workers, we comes to in this category. It's called skilled worker category, and then you will apply your visa like the online. Apply here, and you have to read about what they need, what documents they need to get the residence permit. We will talk about the questions. Okay, so I'm reading in the chat now. Martina has wrote like in the chat, like, is income tax high? Yeah, I talked about the taxes. Like, it's depend. Like I told you, like how much your salary is. If you're earning like 1 million Norwegian crowns, like kroner, if you say. So it's like if you pay like 40% tax, so that's 600,000 will come in your pocket, for example. This is just a general example, but of course, if you have a loan, if you have a house loan, if you have a car loan, then maybe you have to pay less tax, and it's depend how much you want to pay. Like they always ask you how much you will earn in this year. For example, you will write there like I will earn 1 million, so then the tax will calculate it like according to how much you will earn. But you can always change and adjust and something, but everything is online, so you will get to know everything. They have a good system about the income tax. Also, the next question is about how long did you prepare for Norwegian? Learning a language is like a long process, like you will always learn language like every day. Still, I'm learning, like if I hear a new word I never heard it. So you will never finish actually a language, like I'm in my opinion. But like, yeah, as a working for a working level, like, yeah, then I think 1 year it should be enough, like to work in Norway as a healthcare worker. So more or less, if you are studying also same time, so I think it's okay, one year. But it's depend person to person. It can be take 2 years also. So 6 months also. So some people they told me like they learned in 6 months. So yeah. But I started learning in fifth year, in sixth year actually, if I would say, like when I was in sixth year, or like learning a language like proper. So that would say like 1 year, we would say that. Also, like, what about medical Norwegian? How hard it is it to manage? Nah, it's easy because it's mostly is Latin, and it's not like Polish, like like for example, if you would say gallbladder. So in Norwegian, it's a gallbladder. So this is like a Latin, like if you know the Latin, like the medicine is also a Latin language, like, so it's not that hard. Like they use the mostly Latin words. So it's not, it's, for me, it wasn't that hard. Medicine language is like, medicine Norwegian is not hard for me compared to normal Norwegian. This is my personal experience. Also, is there a specific level that is required? Yeah, that we talked about, like B2 is enough. I mean, more than enough to work in Norway. More than enough. This is also one requirement, like B2. If you done the B2 test also, or you speak B2, so nobody ask you anything more. So that's enough. Yeah, but like language is language, so you have to be learned all your life. You're learning all your life. I have heard Lingo gives an online certificate after completion the language course of B2. Is it a certificate enough for there another exam? Yeah, it's enough for to show your employer. Actually, you have to satisfy your employer every time. You have to remember in Norway to, like, you can speak, you can write, you have certificate. That's it. So in interview especially, and also if you have certificate, of course, then you have very high chance to get job. Do we need lack or SASS to just diploma? No. Is there a way to put into words how Norway was easier than Sweden in terms of opportunities and visa process? Yeah, I mean, because Sweden has because I got my first job with the private company, Danish company, and like the good thing in Norway, you have a lot of private companies, like they hire doctors and nurses, so you can they can help you in many ways, like in visa process and getting a job and getting a good salary. So my first job was with one company. So that's the answer of that question. How long did you prepare for Norwegian, and did you do any specific exam? No, I just gave the exam in Norway, and when I came to Norway, so I just have like completed the Lingo courses, like when I was in Poland. So that's the exam, and you can do exams whatever you want, like when you come to Norway. Also, like online also, it's possibility to show the certificates and show your language criterias, like you're fulfilling to your employer. How long time you use to learn Norwegian speaking until you can speak it fluently? That's really it's matter. I mean, person to person. Like, for example, I know people like living in Norway 15 years, can't speak Norwegian. I knew people like who just came to Norway like 1 year before, speaking language. Personally, I am living here 1.5 years, like almost. I can speak good language, in my opinion. I can speak to the patients, I can write, and I also can communicate with them. So that's enough for working as a doctor or nurse. Also 60,000 with tax or without tax? I mean, that was not 60,000, that was 600,000. I mean, $60,000. Yeah, that was. I mean, you have to pay tax also after that. So also that's as junior doctor. Yeah, this is just like not even junior, like you just working, like I mean before you even did your stage or like your internship, the official one. So this is, and this is not like I told you, this is the hospital's salary, but this is not the district salary. I worked in district also, so the salary is much more than this. So yeah. Also, is it after tax? Yeah. Also 600,000 is for list, and is it increased with time or experience? Yes, it is. It's increased with time and experience, 100%. People are earning 1 million also, like list 2 people. So it's possible. Yeah. Do we need any language certificate for these steps? I mean, language certificates is very, 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 very good if you have it, because that it will help you to get a job much easier than you get a job without language certificate. So it's not obligatory, mandatory, but as a European Union graduate, but like it is really important in my opinion. How long is the internship in Norway? Yeah, 18 months. We talked about that. It can be in 2 parts or 3 parts. So one in total, it's 18 months. Do we have to wait for your medical license to be processed by Norwegian government before you can start working? No, your medical license will come in if you are EU graduate, especially from Poland, it will come in 1 week, 2 weeks, or 1 month. So actually you can start your training. I mean, like you can get the training until you will start your job, but you have to have a language, license before you start working as a doctor, because for visa it's a must. You have your education is already recognized by the Norway, and you already get the license, so that's important. Regardless, is it possible to gain clinical experience in Norway before graduation? If so, how does it usually work? Yeah, it is possible. You just have to apply to every hospital. You have to send like 100 messages, 100 mails to every department, everywhere. Like you want to do a clinical experience, and I think as people got a reply. I know some of them have already some talk to me, they have already got a clinical experience already in some other cities in Norway after they applying. So it is possible. If you, a doctor, have any experience about working there before graduating, could you please mention? You adding to the previous question, if you, a doctor, have any experience about working there before graduating, could you please mention? Like, I was in Norway in 2021 for 2 months, for like a small job. But like, yeah, of course, if you have experience before working as a doctor, it will help you. It will help you of 100%, but it's not obligatory, and it's not you have to have, because I know 4 or 5 people like who graduated from Poland, or maybe like other Slovakia or something. So they are working like fresh. And they never have been Norway actually before they graduate and before they get the job. So it doesn't matter. Are there paid holidays once you start with a job? Yeah, I mean, first year you won't get paid than for holidays, 1 month holidays, like totally 5 weeks you are allowed to get holidays, but the next year you will get paid. When we can start applying? I mean, I don't know what you ask about that, but yeah. Yes, there's a 5-week paid holidays for every worker, not just doctor. Yeah, that's true. I mean, does it mean those who already completed STASH in Poland have no opportunity to work in? No, it doesn't matter for them, like you completed your STASH or not. But it's maybe for other countries it matter, but Norway, they doesn't consider that you have completed your STASH. So for them, it's just like you are just because you didn't completed your STASH in Norway, so they don't consider even if you did in Denmark so far. So Poland also not in their list. Can you explain how can one become a general doctor in fast leg? We will talk about after maybe in the next in future seminar or something, because I think it's not relevant for other people. Do I need to have a visa, have a job before applying for a visa? Yes, 100%. You have to have a job contract before applying for a visa. That's a must. How to prove a language proficiency? Yeah, that is like you already did the course, you have already a certificate, you already have passed the interview. They take your interview, they can see you how good you are. Also, how long to wait after starting before start specializing? It's depend on person to person, your experience. I waited like 1.5 years, so almost like more than 1 year. So it's depend on how smartly you working here and where you working, what you working. So it's depend, and that we will not go detail. It's not. Do you have to do a language test before being allowed to work? Yes or no? It's not a necessary for a EU graduate like in Norway as applying for the visa. But if you have a language certificate, I told you it's really good as CV. How do you prove language skills? I told already. They will check also, even if they will check also like when you come to Norway also how good you are Yeah, so don't think about like you just speak like bit. Also come to Norway and just language is very easy to catch like how good you are. So don't worry about that, and they will check. What do you mean by district salary? I'm a little confused. Sorry. Yeah, district salary is because district has their own budget, so they have like always a higher salary than hospital salary. Because district salary, because Norway, because we didn't talk about the healthcare system in Norway, maybe we will talk in future, like yeah, so district salary is higher than hospital, because the district has their own budgets, and yeah, so that's why it's a different salary and better salary. Is there a recommended way to learn Norwegian language for free without having to pay for tutoring courses? Yeah, I already talked about that. Free courses that you can really, that are good ones I share, and you will find more when you will go and try to take the try to learn, start learning the with that free resources. You said about Danish company, did they offer you visa, or you did that? I mean, the visa is not hard. It just, you need a job contract. They help you to get a job contract and job, and then the company will help you what you document if you need more. But they are like responding faster than the employer, like employer in Norway, like Norwegian employer. Maybe the companies people know more about, but it doesn't matter. Some people, I know it, they just got the job directly without company, and I have also got my job, so it doesn't matter here, because there's many foreigner people are working here, so they knew how to do that. How long did you have to work before getting in the list program? I already answered. It depends where you're working, which hospital, what kind of position you're working, what you did before that. So it's that. Is it difficult to enter list and without an experience straight from the med school? Yes, 100%. I don't think so. You can enter in list and without an experience just from med school. So it's just forget about that. You have to work here. Even Norwegian people, even I know like people who studied in Norway, like Norwegian university and Norwegian healthcare, like they know in and out everything about like that. They also even waited 6 months or maybe 1 year. So I know one guy studying in Bergen in university, and he's still waiting for, and it just been 1 hour, because it's depend on where. Also, like it's depend where you applying. Like some people, they wanted to choose where they want, so that's why it can be a bit longer for them. Do you think there is a chance to do clinical experience during medical school with just English? Yes, it is. Apart from diploma and languages, language proficiency certification, what the other qualifications, skill, or internship that you know of that would significantly enhance the chances of getting job? Yeah, of course. If you have a like a research paper, maybe. But they don't really care about that. Skills, yeah, of course, skills always gonna help you. Internship will help you most, if I would say that. Like if you have it, so you know the system, how it works, you can say to your employer, I have already did internship, I know the language quite good, I can Norwegian, I can do that, I can do this, so to the, of course it will help, but it's not obligatory, it's not mandatory. Some people have never have zero experience with Norway, they're also working in Norway, so it doesn't matter. At the time you're doing Norway clinical rotation before graduate, do you speak good Norwegian already, or mostly use English is okay? No, you can't use English, but if you have, for example, even still sometime I didn't understand a word, so I can ask them, how do you say in English? So they can help you with that, and especially when you are new and when you are in a district. So keep I'm always saying like to people, always start with the district and don't go to the hospital first if you have a chance. But it doesn't matter if you can get work wherever you want, like where you get the work, so you have to go for it. But like, of course, if in district it's much a bit easier than hospital. Do you have to do medical science research and write essay? No. Can you take LEC? Does it affect the process? Nope. LEC stars doesn't matter. Okay, when shall we apply for internship, like the specific application portal? Yeah, we have talked about that application portal. It's called WebCruiter. I didn't go through with actually the website, but yeah, if you will check on that website, the last the in this candidate.webcruiter.com, the third one. We shall upload a link to the PDF on Instagram bio. What is the qualify you to get internship as soon as possible list? Yeah, for my qualification was, I told you, I worked actually a lot with the different places, like with different specializations. So it was, I think, actually really good for my experience or my CV, if you would say that. Also, the most important thing is in Norway is a reference, because here they call you on your reference. For example, if I'm getting a job in another place, they will call you your reference. So they will always ask you, okay, who is your reference? You have to be mentioned in your application, like he or she is my reference, and they will call this person, and this person has to be you worked with that person, and that person will say, okay, yeah, this person I worked with him or her, and it was very good, or something. So it's important for you wherever you work. So don't get the bad outcomes from the place you're working. It doesn't matter wherever you work, because it can really affect your next job. Also, how we able to gain experience right now in med school? Should we email hospital to ask for internship support with English? Yes, do it. Like you are really wanted to willing to work in Norway, and you have this qualifications or whatever you have, and then try to learn, and if you will get response. Yeah, but of course, if you will do with the Norwegian, much easier. Does any internship or training in UK can help with Norwegian lesson application? Nope. There's nothing we are. Here in Norway, they are talking about UK or USA. So, of course, if you are a specialist in UK, I think it's approved here automatically, but not internship. How to apply for district job? District job, you can apply with the on web recruiter, same, and they have every job on the web recruiter. So you will you can, there's hundreds of jobs there, so you will see like where where they need actually the person. Like, for example, I can try with the Google. So you got the experience after applying and waiting for a list position, or before that? Yeah. You keep applying for the list one. You keep applying parallelly, like side by side, when you are working. So I never sit at home and okay, I have to wait for the list and to start working. So I'm working, I'm applying, I'm working, I'm applying, and it's 2 times you can apply in a year. So in February, also in August or September. So it's 2 times. As a 4th year student, I got myself a summer job in Legevakt. Is that a good pathway to get enough experience to get internship? 100%. This is really good experience because Legevakt, you get every kind of patient in district. It is not important to do internship, right? We can also directly apply for job. Yeah. You can always apply a job directly in Norway. There's not like obligations like you have to do internship. How to find job before list one? For example, so for example, if we write WebCruiter, so this is the portal where we are talking about the jobs. It's WebCruiter. So you have to be logged in with that, and for example, you have to make account on that, and so I hope I remember the password. Yeah. So of course, so this is the positions. For example, if I will put in English, yeah. Yeah. So for example, this is the vacancies, and you will write like you will see here health and social care, or maybe more specific, we will take the position type. Like here. So, for example, like if someone was asking like how to apply the jobs, you see the jobs here. Like you can apply any job here, like every job here. Like don't think about it's a list 2 or list 3. You can apply. Vicariat means temporary. Ledig vicariat, son. So you can apply any job. For example, if you go to the this job and then you have applying here, you search here, go here, and then you just apply. So this is automatically like you can fill your CV here. Also you can make your CV. So for example, if you will click on the CV, so this is my CV, like if you will go there, so this is this. So this portal is really good. Like you don't need to be make your CV by your own. So I would say like just apply these positions. And if you wanna see the where is the job, like it's written like which part, like I mean, like what's your gonna be role, you can change in English if you want to read it, who is your contact information and everything. So there is many jobs here. Okay, who you write like what part of Norway is a preferred location to work because some of the dialects are difficult? Yeah, this is a good question actually. Like the dialect one, because Norwegians speaks very different like dialects place to place. But I mean, if you learn the language bookmål, it's called the bookmål. So I mean, it's fine. I think you don't need to be learn specific dialect, but of course, if you're living in that specific part, like and people like to speak that dialect, so you can just change a bit, or so you will be good. But everyone understand the dialect. I mean the normal bookmål, the language like normal Norwegian. So you don't have to be focused on that part. But like if you speak the dialects a bit, it's okay. But I mean it doesn't matter. But it can be sometimes it's hard to understand sometimes when you come to a new place where they speak the dialect more dialect like so it will be fine after 1 month or something. So it's really up to you how fast you gonna be. It's not really affect your job or something, but it can be like sometime. Is it lege uten license type of job one can apply before internship and after university? No, I mean there's only one type of license you get. Only license change when you are done with with your list one. So it doesn't really matter. Also, yeah. Also, if someone has a question about, like, for example, I can show you this portal also. This is the medicine portal. Like if you will write the paracetamol, right? So if you will write the paracetamol here, so there's so many paracetamol companies, some selling the paracetamol, and this is like the how you would give like 500 this indications and everything, how much dose you have to give, mixture, and this, and like what is the side effect or this. So this portal you can check it out if you are. Is there an interview for clinical rotation, internship application, and job before listen? Yes, of course. It is. There is an interview always and always. So clinical rotation application, yeah. So there is always an interview for every job you will apply. But you will find the job and internship. You can apply also here. Everything on this portal you can find it. After med school, what license do we apply for? If you go to this one, health lecture, this one, also this one, and then you will click on the If we go to the English here, authorization and health personnel there, and then you will apply for choose profession, apply for the, and then you have authorization license for health personnel, and then you will choose what, for example, here medical practitioner, lege, and continue. Where did you obtain your basic health education? You, and then what you are applying for, authorization, and then you will go for to this one, application form, and then you will, they will then you have to go from, yeah, we can talk about this thing if someone is interested later. Yes. Also, is there any procedure books in different specialties, and where we can find them? Yeah, you can find it there. Pull the book. This is called Method Bouquet, and this has all books you can find. Internal medicine, infection, endocrine, here everything. So every book, for example, if you want to have surgery, this is the gastro surgery book from this hospital, orthopedy from this hospital, hand surgery, also then. So this one you can find it. You can find Legevakt also. There are so many books. So these books are free. Is it hard to find a job before listen as a non-EU citizen? Nope, not really. It is not hard. If you will keep applying, keep learning language, keep trying your best, I don't think so. It's hard to get a job. Of course, it is challenging in the beginning, like when you are especially as a non-EU, of course, but it is possible. Also, someone wrote, like, if you want to do post-graduation, especially in Norway while working, can we do it in English? No. Forget about English. Don't think about English. Thingy. There's you can't do in English anything here, to be honest.
All right, then. If you guys have no more questions, I think we can all let Dr. Vikas go now. And thank you for attending, and thank you, Dr. Vikas, for hosting us. All right. Thank you so much, everyone. Thank you for attending. Thank you, Dr. Vikas.
Yeah, thank you. Thank you for organizing this.
Please tell us what you liked or disliked about the video, and ask any questions in the comments. If this video is useful, please give it a like. All links discussed in the video can be found in the description, and please use those links and subscribe to the channel to support us so we can keep producing content. Thank you, and maybe watch another video.